Hey everyone, today I'm so excited because I get to chat with Dr. Christina Economos, who is the Dean of the Friedman School of Nutrition Science and Policy at Tufts University, the New Balance Chair in Childhood Nutrition, a professor at the Friedman School, and professor of Public Health and Community Medicine at Tufts University School of Medicine. Chris's pioneering research has brought evidence-based systems-level solutions to the forefront of policy and practice. In October, she was named as a member of the National Academy of Medicine. I am also pleased that I can call her a good friend of Food Tank. Congratulations on being named for that. That was awesome.
Thank you so much, Dani. Real honor. I'm just so pleased to be part of that now. And thank you for having me today.
Oh no, we're thrilled to have you. So I guess my first question is for those, I've tried to spread the Friedman message
Yeah,
far and wide, but for those folks who don't know what the Friedman School of Nutrition Science and Policy is, can you give us an overview?
sure. So we are the only school of nutrition in North America. You'll find many departments within universities, but we're an entire school. So we think of ourselves as cell to society. We have 13 specializations. We train master's and PhD students. We have continuing education. We're going to start executive education. And then, of course, we do a lot of research. So all the faculty are engaged in research. And our goal is impact. We want to impact nutrition and food systems and people across the globe. And as you know, we're engaged in lots of different things in the country, in Washington, and lots outside the country as well.
Absolutely. You recently led this really strategic and important transformation of the Friedman School. Can you talk about that as well?
Sure. There are three pillars. I've been dean for a couple of years and I'm an alumna of the school. So my heart is with the school and I want it to be unbelievably successful. And I know we share that together. So the three pillars are education transformation, research growth, and brand evolution. And so under education transformation, as I described, we have lots of ways to engage with the Friedman School, from a degree to a single course to a continuing education program.
Right.
But what was really important to me was to make it more affordable, accessible, and flexible. And I'm
Hmm.
looking 5, 10 years out. How do people want to learn? Many people want to learn online, or
Right.
they need to keep working while they pursue a degree. And that's what we have developed with our new online degree, for example. So those three things were really important to me. We also expanded what we offer. AI data analytics in nutrition. That's a new offering at the school. So trying to be current and even forward thinking with what we do. Research growth, our faculty do research against cell to society and really making sure that we're working across the globe and having impact and partnering with lots of other people, not just universities, but on the ground, NGOs, governments, to really solve real world problems.
Hmm.
And brand evolution is really making sure that we tell people what we're doing and
Right.
we're accessible. So we have a lot more going on with, I would say, public facing work, including this. So that's really important to us as well.
On that accessibility point, one of the things I like about this new transformation is that you're really democratizing what was once really, uh, behind gates, behind those academic gates. You're really making
Right.
it available to a lot more people. I'm interested in why that was important, particularly for you.
Yeah. So food impacts everything we do. I mean, your entire organization is incredibly successful, and you talk about food in all aspects across the globe. There's almost nothing you can bring up with someone that doesn't involve food and nutrition. And we need a lot of people thinking about that and solving the complex problems that we have, getting food to people, growing food, consuming food, producing the way we do with the food industry. So we need people with talent in many different areas. And
Hmm.
we also want it to be equitable. And what was really important to me was to make sure we were training diverse thinkers from
Hmm.
backgrounds that range from, all incomes and races and ethnicities and geographies. And really, that we're all thinking about this together. There's no question in my mind, problems are solved by diversity of thought. And we do much better. And you know this when we have lots of different people thinking together around the table. And so you're right, democratizing, the educational process has been really important to me. And as someone who, went to many schools through the years, and it wasn't easy for me to do
Right.
financially,
Right.
I'm proud of the fact that I stuck with it and did it, but it wasn't without a lot of mentoring and assistance along the way. And I want to give that back to as many people as possible.
Oh, that's incredible. And I love what you said about diversity of thought. It's diversity of thought, of people, of practices. That really says Friedman to me in so many ways. I would be interested in hearing what the demand from students is like right now.
Yeah, it's great, which is wonderful. I mean, you don't have to, really question the importance of nutrition today when we have 42 million people on our supplemental nutrition assistance program who aren't getting their benefits right
Right,
now. And,
right,
there are stories going on right now and being communicated that are devastating and heartbreaking. So there are a lot of young people that want to get involved. They
right.
understand there's a federal system, there's a state system, there's a local system, and they want to work at different levels to make sure that food is accessible and it's healthy and that we're producing it as best as we can. And there's equitable distribution of it. So we're really seeing a high demand, especially for our online degree, where we
That's
have
great.
people now from across the globe who might still be working, could never move to Boston, and are now able to engage in a really high touch way with the degree.
Oh, I love that. I love that. I wish that had been around when I was there, but I'm glad it's happening now. You mentioned AI and offering courses that really are around that and nutrition. Can you talk about how you've developed those courses and why why AI we need to be thinking about AI when we're thinking about nutrition?
Sure. So we've collaborated with our School of Engineering. We're lucky that we're at a university that has one that has a new AI institute and, of course, offering degrees as well. So this is a really important collaboration. So the foundation is being taught, and then we can build on that with courses that are specific to how you would use AI in nutrition. And, it's really endless the way we're going to use it in the
Hmm.
future. And
Hmm.
really equipping future leaders to do that, whether it's impacting how food moves around the planet
Right.
or whether it is solving problems. There are, as you know, many ways to use AI. And we want to make sure that we're putting people out into the world who are using it effectively and
Right.
efficiently to help solve some of these large problems.
Yeah, it's really preparing future leaders to understand how it works.
Yeah.
You talked about the global sort of intent of the transformation of Friedman, and you recently announced an agreement with the Indian Institute of Science. Can you talk about what that agreement looks like?
Sure. So we were lucky in that the Indian Institute of Science, which is located in Bangalore, was a is building a new medical school and a new hospital. And so I had the opportunity to meet the director well over a year ago to say, would you be interested in being the first medical school and hospital to institutionalize nutrition from day one? Not to
Wow.
put it on,
Yeah.
not to, in a very fragmented way, try to get that information into the training program, but to institutionalize it from the moment a student walks in the door.
Wow.
That's what we've done is we launched a new center called the Interdisciplinary Center on Nutrition Science and Medicine. And we
Wow.
launched it in July, and we are now on our way with curriculum development, research partnerships, and we hope this is a model for
Yeah.
other medical schools around the globe. I know we're working hard in this country to really ramp up the amount of nutrition training we're doing. And it's not just providers being aware of and educated about nutrition, but it's having the ability to refer to a clinical dietitian, right? This is what we want is a partnership in healthcare. Nobody wants to be
Yeah.
treated in a fragmented way by 10 people who aren't talking to each other. We
Right.
want holistic healthcare. And we want a dietitian working hand in hand with our healthcare providers.
Absolutely. It's so exciting. It really institutionalizes and embeds food as medicine,
Yeah.
where it needs to be embedded. That's very cool. Um, on the point of food as medicine, you have led the Delta Greens Food as Medicine project in the Mississippi Delta. I know this is something very close to your heart, and I want you to have a chance to talk about it.
Sure. This is an NIH funded study, launched a randomized control trial in the Mississippi Delta where we're working with local growers. So we're trying to help them produce fruits and vegetables that serve the needs of people who live
Mm-hmm.
there,
Mm-hmm.
toward chronic disease prevention. So it's a year-long randomized controlled trial using produce prescription or produce boxes with locally grown produce in collaboration with the Delta Health Centers. And we are looking at hemoglobin A1C, blood pressure, BMI, lipids, and lots of other biomarkers and variables that are important, including food security. And, we're hoping that this adds to the evidence base of food as medicine, which, as you know,
Right.
is being implemented as medically tailored meals, medically tailored groceries, produce prescription, lots of different models. But the point is to integrate food into healthcare and to make
Yeah.
sure that when people have a high A1C level, they're not just being told what to eat, but they're giving the opportunity to try new foods and to bring those home and to start consuming them as a family. And that's really what we need to be thinking about, not just giving someone a pamphlet, but teaching
Right.
and providing them with food and getting them connected to better access. And that could be SNAP, it could be a food pantry, it could be reallocating their own food dollars to really prioritize healthy foods.
Right. Chris, often when I hear about, these produce prescription boxes, I get really excited. I think we all do. But I also wonder, what the barriers are because I know, um, from talking to folks with lived experience all over the country and all over the world that often people, one, they love the idea of getting fresh fruits and vegetables, but they don't know what to do with them.
Right,
And then
right,
often they don't have the tools like the cooking supplies or,
right.
working appliances to actually,
Yeah,
make these fruits and vegetables delicious and
right,
nutritious for their families. Can you
right.
talk about those barriers?
Sure. The barriers are really endless when it comes to this. And a lot of us who have the privilege of being able to bring fruits and vegetables into our home with good knives and storage don't think about it as much. It's not the
Right,
case everywhere.
right,
So you're really, bringing up a good point that people really need the behavioral mechanisms to change are complicated. And we're studying that as part of this with an
nice,
age supplement and really staying with people through not just 12 months, but 15 months, 3 months after it's over.
nice,
Really understand how they changed, what motivated it, what were the barriers, while providing nutrition education and practical resources. So, a cookbook that
right,
is made to utilize the local produce with relevant recipes for that
mm-hmm,
area of the country
mm-hmm,
as well as videos that we've made that are made by a local dietitian who really understands
nice,
and Southern cooking and how do you
right,
make that healthier, as well as access to a teaching kitchen so people can come in and actually see that work being done and begin to understand. But even simple things like in the videos, how do you hold a knife and how do you actually chop produce? That's really important. What kind
yeah,
of you need. So this study hasn't gone as far as providing knives, for example, but I know a lot of the food as medicine studies have. And that's important to have a good chef's
right,
knife so you
right,
can
yeah,
actually start to work with the fruits and vegetables. We've given storage tips. We've done a lot with how do you process and freeze and store
nice,
for longer periods of time so you can pull it out, a month later and start to use those fruits and vegetables and you're not wasting it because that's a fear with produce boxes is can I get through it in a week? Well, you
right.
can if you prep it and store it and freeze it. So we've done a lot of things like that to really make it practical for people.
It's so smart. You've said that there's typically a hierarchy in academia, but with Delta Greens, you said you're trying to flatten that as much as possible. Can you expand on that?
Sure. I mean, the first thing we did, which a lot of us do in research, is we worked on the ground. So we talked to people who live there. We talked to the providers. We talked to the growers. We did formative work, and we're publishing that work, in qualitative papers. And that was really important to understand how we could meet people where they are.
Mm-hmm.
We have incorporated voices and participation from all of those people every step of the way. And the goal is not to come in as researchers and be extractive, but to develop a system that's sustainable. And that
Right.
includes policy, that includes capacity, that includes resources, skill building, and that's what we're doing every step of the way. A
That's
lot of
exciting.
investment has gone into the agriculture piece. Um, it's hard when you don't have access to capital to begin
Right.
farming. Farming supplies and equipment is expensive, and if you fail, you go into debt. So
Right.
access to capital is really important, and we're creating new pathways for that.
So fundamental. Um, I wonder when you went in initially, how did you build trust? Because,
Mm, yeah,
these researchers from Boston are coming
yeah,
in,
yeah.
and I wonder what people thought.
Sure. I mean, I've spent my career doing this kind of community-based work or whole of community work. And trust building is one of the most important things. And you have to be working with local partners. You can't come in from the outside without engaging and building capacity in your local partners. So that's absolutely what we've done. And we're really leading, I'd say, from behind or leading from the side. And
Hmm.
that's
Hmm.
important as well. Having people who are there and who will be there for the duration be the ones really leading from the front and building up the capacity and the skills so that they can continue.
That's really great. You mentioned, working with local dietitians, and I was part of a conversation yesterday where I said, this is the moment for dietitians. I feel
Yeah.
like there's really, a momentum building around food as medicine, and their work is more important than ever before. Can you talk about, how you're training this next
Sure.
generation of dietitians?
Yeah, I should have said that initially. As part of our master's program, we have an MSDI program. So we do train people at Tufts Medical Center and the Friedman School to be the dietitians of the future. And so they're integrated within the Friedman School as they're doing their clinical training, which is really, really important. And, finding more and more of them are interested in things like culinary medicine or like
Right,
women's health, or really specializing in preventative medicine
right.
and lifestyle medicine. So this is a real movement that I think people are excited about, and they have a lot of opportunities to work with us while they're at Tufts. And I'm knowing we were going to talk, I made a list of the things in the past 3 days that I either heard my faculty talk about, or I was in a conversation about, or I read an article about. It's really like top of mind, and it's
Nice.
a really long list. Can I read it to you?
Yeah, of course.
Because I feel like this is kind of what we're doing and what we're talking about. So it's going to be a long list, but
Great.
this is what is important right now and what dietitians and all of our faculty and students are thinking about and talking about. Front of pack labeling, ultra processed foods, behavioral mechanisms underlying dietary change, food is medicine, culinary medicine, federal nutrition programs, food security, GLP-1s, diet and cancer, the microbiome, precision nutrition, famine prevention, women's health and menopause, nutrition education in medical schools. And last but not least, how do you act at the community level? So
Wow.
in a couple days, that's what I was working on and engaged in. And, you cover those topics all the time, and they're really exciting. Things are changing. And I think we're
Yeah.
on the forefront with a lot of our research and education, but in partnership with you and, our colleagues across the country, there's a big movement.
Absolutely. There is a big movement. You talked about SNAP earlier as well, the Supplemental Nutrition Assistance Program, and the cuts that, we're seeing, and the pain and suffering that's causing. But we also have a lot of bipartisan support right now for things like food as medicine. And so how do you see sort of reconciling those two things? One,
Yeah.
sort of the cruelty, right? And this is I'm not partisan in any way at Food Tank, but that's intentional cruelty. And then, supporting these wonderful, produce prescription, medically tailored meals, medically tailored groceries that can really help people.
Yeah. I mean, my understanding is that overall there is compassion and interest in feeding people. And, I've heard that from everyone, and both sides in between, et cetera. I think that the SNAP program is caught up right now in a really unfortunate moment. Um, and it is, I think, igniting a lot of people across the country to say, wait a minute, if it's come to we're in this developed country, the most successful, wealthiest country, and we're not able to feed people, what is wrong here?
Right.
I'm really happy to see not just the charitable food system coming to the rescue, but also people really understanding now it's that fragile that we could at any given moment have people who don't have enough to eat or feed their children or older people in their households or people with disabilities, et cetera. And yes, a couple days isn't good, but there will be consequences of this for a while.
Right. Right.
So how do we reconcile that? Food as medicine is an emerging area, institutionalizing, food into our healthcare system, which is long overdue. And the research is what's really important right now. We don't have this feeding over 40 million people like we do SNAP or WIC
Right.
feeding, over 5 million, or the school meals program, feeding over 10 million, I mean, or more than that, 20 million school lunch. So food as medicine is really still an emerging area where
Hmm.
we're
Hmm.
doing more research to generate the evidence to demonstrate the healthcare savings and the return on investment. So I think the energy is there because it's new, it's exciting, and everyone knows that it's going to be beneficial. So the
Sure.
energy and I would say enthusiasm is toward fueling that research so we can understand it better. So it feels like two different things to me versus an established set of national nutrition programs that feed
Mm,
tens of millions of people that
right.
have been in place, for decades and that have good evidence already.
Right, right. On that same point, how do you as an academic think about the impact and influence of MAHA?
Yeah. I mean, I'm following MAHA very closely. We all have looked at the report and the recommendations that have come out. And I saw a lot in the recommendations that came out that were strong and that were really important. I'm really interested in the implementation. I
Right,
consider myself someone who does action-oriented research. I understand the complexity, I understand implementation science, and I understand multi-sector work. And
right.
that's what I need to see is how are all the recommendations going to come together and how is the federal government going to partner with academia, with not-for-profits, with the private sector to get this done together. And I haven't seen those details and I'm really looking forward to them.
Yeah, I think we all are. You mentioned the importance of research, and we're living in a time when science-based evidence are and academia are under attack.
Yeah.
How, as the dean of this, incredible school, are you sort of handling that?
Yeah. I mean, we continue to generate evidence and we know it's really important. Some evidence is new, some are replication studies where we're reinforcing something or making sure that when you test it in different populations, you're getting the same thing or you test it over time. We're not going to stop doing that. Evidence has fueled the most important decisions that we've made in this country, and it will continue to do that. I think most people understand the importance of it.
Yeah,
And that is what we do and what we will continue to do. We also do a lot of translation. We don't want it to sit on a shelf. Nobody at the Friedman School wants to publish a paper and have
right,
no one see it. They
right.
want to be talking to you and going to your events and being on the ground and making sure that that translation is happening. So it's not evidence for evidence sake or just to be a scientist. It's to help and have impact for the entire population. And we do studies, from pregnancy all the way to old age. In fact, we
Right.
have the Human Nutrition Research Center on Aging that is expert in the aging process. And we want to make sure we're serving everyone. And people are living older to be
Right.
now. And so we need more research in that area. So there are a lot of really important questions, Dani, that we don't have answers to yet. We could get
Right.
into this with GLP-1s and the microbiome and precision nutrition. We don't know yet. So if we don't generate the evidence, we're going to be guessing. We're going to be giving people recommendations and information that might work and they might not. And that's not really who we are as a nation.
What kind of research needs to be done on something like GLP-1s right now?
Yeah, yeah. So that's a big topic. And as you know, there are many GLP-1s on the market. There are many in the pipeline. Currently, weight loss 8 to 20% with the current
Hmm.
medications. The next generation coming may produce more. And when I say that, I mean percent body weight loss. So there's a lot that comes with that. There's muscle loss, there's bone loss. We need to make sure that there is rigorous nutrition interventions
Right.
alongside GLP-1s so people, as they eat more, still get the right nutrients. We need to make sure that they're preserving their bone and muscle as they're getting older, or that will lead to frailty. A lot of people are experiencing gastrointestinal distress. We need to make sure they're getting the right nutrients while they're going through the adjustments of which medication is going to work. And then I will say we need to understand if you can remove the medication and retain weight loss. Most of the studies now show no. And so, what does that mean when someone loses a lot of weight? A lot of it is lean body mass in the form of muscle, and then they regain, and it's mostly adipose tissue. That is not the body composition you want as you age.
Yeah.
So, really working on dietary interventions, strength training, physical activity alongside a GLP-1 is what we need to do. And there's a lot of calls for that and the research needs to get even better.
Yeah, absolutely. So much to be done there, but
Yeah.
I'll be excited to see what Tufts comes up with. Going back to Chris, the potential food as medicine,
Mhm.
yeah, are and its goals to expand, things like organic or regenerative agriculture. Do you think that, one, that the students on campus see those connections between, food as medicine and more sustainable agriculture practices? Do professors see those connections? Do the policymakers that Tufts is trying to influence see that connection?
There's no question we see it at Tufts. I mean, we have an agriculture, food, and environment and climate area at the school, and we really try to make those connections. A food system is a really complex system, as you know, and we do think about it in every way. And, the health of our soil and the health of our planet and the health of our people. Healthy people, healthy planet is really, really important. So we're thinking about that a lot. We're doing a lot of research on it. And the study I was talking about that I'm leading is working with local growers. So we are thinking about that. A lot of our food isn't grown by small farms, it's grown by much larger industrial farms, or it's brought into the country. And as much as we can start to break that down into smaller, more local, the more we can actually focus on, as you mentioned, the heart of agricultural practice, which is being in touch with the earth and making it as healthy as possible. So there's a lot of people working on this, and we are, but I want to give credit to many food as medicine studies that are working at the local level and really trying to focus on local agriculture and practices.
Absolutely. When you went through your list of things that you've heard
Yeah.
or talked about this week, you mentioned culinary medicine, and I think that's a term that many of our listeners might not understand.
Sure, sure. So we're excited. We just launched in the spring a new culinary medicine class at Tufts, and we have students from the Friedman School of Nutrition, our medical school, and our dental school working
Nice,
together in this class. And
nice.
that's really what you want is healthcare providers who are all understanding, number one, what is healthy and nutrition. Number two, how to talk to your patients
Right.
how to begin the process of actually preparing food, acquiring food, et cetera, and then how to shape meals to become healthier. So the curriculum that they're using in partnership with Community Servings and Not-for-Profit in Boston
Nice.
is focused on nutrition science as well as the culinary aspect and motivational interviewing and how do you actually incorporate that into your practice as a healthcare provider
Oh,
or a
wow.
community educator. And, we need to do more of this. I'm amazed at how many young people don't know how to cook. And that might be okay if you're, in your teens or your 20s, but that's going to be a lot harder to survive when you get a little bit older and you're not able to cook for yourself. And, it's really the key to not only longevity, but chronic disease prevention. And we
Right.
want lifespan, health span to really be together.
Absolutely. I love that the dental school is involved. Can you
Yeah.
talk a little bit about why it's important to have those dental students involved in this kind of work?
Yeah. Yeah, I mean, they're first line often, right? They can see things that are visible in gums and in teeth that are the direct result of diet.
Right.
They want to understand more. They also have a lot of time with people. So they
Yeah.
can have really important, instructive conversations. They can make referrals. They can give information. They can check up on people as they come in frequently when they're under treatment. And they're really excited about being part of it. And I'm just talking about what's visible in the mouth, but the
Right.
microbiome, I mean, there's no question, that that's going to have an impact as well on lots of things like the eye, for example. So
Right.
there's a lot I think that the dental practice is excited about and incorporating them in. They get nutrition training in the Tufts Dental School too.
Of course they do. Of course they
Yeah.
do. You also talked about precision nutrition. Can you
Sure.
explain that to our audience?
Yeah, absolutely. So there's the umbrella term personalized nutrition, right? Where that's really people trying to see what's working with their bodies and in a very general way begin to customize their dietary habits or their dietary patterns. But precision nutrition gets to a whole other level where there's a lot of work going on around the country, including at Tufts, where they're studying, lots of people to understand things like the microbiome, genetics,
Hmm.
behaviors, and their environment, and understand how people respond differently to dietary patterns in foods. So, if you look at a study, for example, there's a lot of heterogeneity in how people respond to a particular diet. And that's not just are they eating the diet or not, it's based on a lot of those things I mentioned.
Right.
If we have a map of someone's, call it internal system, with their genetics and their microbiome, and then their external system, for example, the environment that they live in, um, as well as many other variables, we'll be able to understand which diets are right for different people toward healthy living and prevention of chronic disease. So this is a massive undertaking across the country funded by NIH, where we're not at a point now, if you walk into your physician's office, they're going to take all those measures and then tell you what to eat. But hopefully we will be someday, and that will prevent and even manage lots of different diseases.
Absolutely. Again, going back to your list, you mentioned the federal nutrition programs that are out there, and also, that you're hearing from students and faculty that they're worried about famine. And so,
Yeah. Yep.
if you can talk about the U.S. and then globally, what we're
Sure.
seeing.
Sure. So we have our Feinstein International Center, which really focuses globally, and they focus on world hunger and famine prevention. And they often work in areas of conflict
Hmm.
where you see famine. This can be influenced by climate, it can be influenced by conflict, it can be influenced by politics. There's lots of reasons that people aren't being fed. And so we do study that. I think importantly, investigators in that area are trying to really understand a framework so that it can be prevented.
Right, right,
It isn't caused generally by just one thing, and it
right.
doesn't happen overnight. So how do we get ahead of it for future situations globally where we can begin to look at indicators and help to prevent that from happening? So yes, we do a lot of work across the globe in those areas.
I'm so glad. I'm so glad that you have this global framework to talk about these things. When I was with you in May, we touched on this a little bit that, students or people who are recently graduated, the world is not what it was when they probably went into their programs. And how do you, as dean, keep them motivated and excited about the work that, they still can do?
Yeah. Part of it is our alumni, including you. When they see what our alums are doing across the globe, almost 3,000 strong, they're amazed. I mean, and I don't really go anywhere where I don't walk into a room and I see Freeman alum who are
Right,
working in Washington. I was just in Saudi Arabia and there are alums there. I'm
right.
India, there are alums there. I'm traveling a lot and I'm seeing our alums doing amazing things. So I think that's really motivating to know that they're out there having the kind of impact that they can have. And I think the other thing is they are really fueled by making the world a better place.
Yeah,
And they know that we're not going to stop eating. It's
yeah.
impossible. So there needs to be a constant food supply, and it can be better, it can be stronger. There's cellular agriculture. We're working in that space. We're going to need to feed a lot more people in a time when climate change is real and it's impacting crops and farmers
Yeah.
and disease. So I think they are motivated by what they see coming and by the fact that our alums are making a really big difference.
Oh my gosh, your alums are making such a huge difference. I was at the American Public Health Association conference this week in DC, and so many Tufts folks came up to me afterwards, and it's just like it's exciting to see. And I have to say, like, it's especially like, these young women who are excited by what I'm up to, but are doing incredible things on their own. And it's just fantastic. It makes me cry a little bit because I get a little bit overwhelmed by their sort of enthusiasm and just,
Right.
like you said,
Right.
ability and want to change the world.
Yeah. And a lot of our students are trained by our economists in
Yeah,
our program. We have an interdisciplinary faculty, and economics is also not, like that's always going to be an issue that people
right.
can work on. And the economics of food and food cost and the consequences of eating poorly. This is all really interesting to people, and these things aren't going away. So there'll
Right.
always be employment, there'll always be problems to tackle. And there'll always be a need for our alums to be out there in the world doing really important work.
Absolutely. Chris, I want to end on some advice for people who are interested in Friedman or interested in pursuing this line of work.
Great. Yeah, we'd love to talk to anyone. We have lots of opportunities for prospective students to engage. They can come to info sessions online, they can come visit us, they can send us an email. But the most important thing is to go to the website and they can find all this information. So nutrition.tufts.edu. And we'd welcome conversations with anyone. We love young people who are interested in making a difference. And through our online program, there are people of all ages who are
Right.
joining us, including mid and late career people. So there's never a wrong time to think about continuing your education.
Oh, I love that. I love that. Chris, always a pleasure to talk to you. Thank you for the work you're doing.
Thank you so much, Danny. It was great to be with you.